Hi, I am Kayla Walsh, and I'm going to be doing a redo for the oral med video. Okay, so this skill begins in the med room where I will be logging on to the EMR, selecting the patient tab, and then selecting the patient for today. So we have Michael Head of 42444, and then I'll be selecting the to-do list and going over the orders for today's medication. So today we have lisinopril. It is ordered at 10 milligrams to be given orally. Just some implications with lisinopril. It's an ACE inhibitor, and Michael is allergic to sulfonamide, so we're just double checking that it is not a sulfonamide. In correspondence with Michael's health history, lisinopril is typically given to aid with congestive heart failure and hypertension. So we are just going to want to check his vital signs and his blood pressure. If his systolic number is lower than 90, then we are not going to want to pass lisinopril because it's going to make him too hypotensive. It was also stated in his chart that he does take other medications to help with his high blood pressure, so we just want to watch for those additive effects with lisinopril to again make sure his blood pressure doesn't get too low. Right now he's at 176 over 90, so we are good there. Other implications is that it was stated that he has bilateral edema rated at a 3 on both legs, and some of the adverse effects with lisinopril is that it can cause angioedema in the throat and the larynx. So if we start to see signs of that, after giving him the medication, we'd want to stop immediately and notify the healthcare provider. It was stated that lisinopril can be given with water, so we will be giving that to the patient while we are administering the medication today. After which we're going to be logging on to the AcuDose and finding the correct drug, which is lisinopril, and going through the 6 rights. So once we log onto the AcuDose, again, we are going to be finding lisinopril at 10 milligrams. It's going to be given orally, so we're going to look for appropriate forms that lisinopril is in to give orally, such as liquid or tablet form, which it says that lisinopril is in tablet form, so that will be good to pass to the patient orally. It's ordered at 11 a.m. Right now it's about 10:50 in the med room, so we are on track to pass it at the appropriate time. We are just double checking again that it's not a sulfonamide, and once we have selected the lisinopril, we are going to dispense it and make sure that the packaging is intact, that the medication is not expired. It expires in December of 2022. It is December of 2021, so it is intact. It's not expired. It is not a sulfonamide. Once again, checking that it's for Michael Head, 42444. It's in 10 milligrams, and it's to be given at 11 a.m. So since it's dispensed, and we have double checked in the EMR and with the actual medication, that again, lisinopril 10 milligrams, 42444 for Michael Head, to be given at 11 a.m., given orally. We've got it in this tablet format. I will log out of the AcuDose and the EMR, and I will be getting a med cup and a cup of water for the patient, as well as a scanner and the pill cutter in case we need to adjust the dose size. And then I will be going to the patient's bedside, so I'll knock on their door, make sure I've got the right room, and ask for their name and birthday. Hi, are you Michael Head, 42444? Awesome. I will double check their MRN number and introduce myself. Hi, I'm Kayla. I'm going to be giving you your lisinopril. So I'm going to be logging on to the EMR. I will scan their bracelet to make sure that I have him pulled up on the chart. And then once I do, I'll be going over to the admin. And then once I am there beforehand, I am going to be scanning their bracelet once again and scanning the lisinopril to make sure that we are on track. And I'm just going through those 6 rights once again, that I've scanned the patient's ID band and the medication, that it is the lisinopril at 10 milligrams to be given orally this morning at 11 a.m. for Michael Head. We double checked on that wristband and on the EMR, that is 42444 on both for Michael Head. Got of Lisinopril right here. So I'm going to open it out and get the Lisinopril, and then I will be putting it in a med cup for the patient with a cup of water, and then I'll be assisting them to an upright position, and I'll be helping them with taking the medication. So after which I will get the medication for them and assist them with swallowing it if they need it. And if I needed to adjust the dose size, I would have done so in the med room, but if they do refuse partial dose or the entire dose itself, I would want to record that appropriately in the EMR and dispose of it in the Sharps container. Otherwise, we are going to be documenting that Michael had 424/44 took the entire dose of Lisinopril, 10 milligram tab, at 11 a.m. We double check that it is not a sulfonamide with his bracelet and the drug itself. And once we have done so, we have wrote down the accurate time that we watched the patient swallow it, that it was Lisinopril 10 milligrams, 424/44, that's his birthday, and it is at 11 a.m. I'm just going to scan my own ID to verify that I, the nurse, was the one who watched this happen, and I documented appropriately. And yep, just double checking the time, and then I'll hit save and continue in the EMR, and I will wash my hands and exit the patient's room.